Many patients were not able to do enough research or were unwilling to do enough research to prevent a bad all-on-4 outcome. So we are often called upon to rescue or salvage a bad all-on-4 case. I will tell you that it's not easy. Of course, we'd like to start fresh with all the bone and all the teeth that the patient had prior to surgery, but we can sometimes rescue a bad all-on-4 outcome. In this particular patient, we did have a very nice outcome, even though her bone will be compromised forever. She was pleased with the final result. This is a picture of her with no facial animation. Here she is with full animation and a full smile. Here's a close-up of her smile, and you're starting to see that the teeth and the acrylic do not look great. This is why she came to us to try to get something better. And here's a better look at why she's unhappy. She signed up for All-On-4 treatment, really didn't understand what she was getting, and afterwards was very displeased about this stage of her treatment where she's just in temporaries, but they couldn't guarantee her something that would look much better. You may have seen my other YouTube video called Lips Retracted Photography, and this is why I'm so passionate about the retracted lips images, because they show the foundation that the teeth sit on. Based on her previous picture, the smile picture, you might have said, well, that's not that bad of an outcome. The teeth just need to look better. Well, here you can see that there's spaces between the prosthesis and the gums. The abutments are exposed, and the teeth are generally not very pretty. This is the right side view of her prostheses, and what you'll notice here is anywhere the abutment is exposed or the abutment and the implant are exposed, you cannot make the acrylic touch the tissues. So this creates a space, a very large space in some patients, for food entrapment, and also the problem with speech, where air is going to go over the top of this prosthesis. Here's the left side view, and the left side is not as bad as the right side, but it's still not good. When we take the prosthesis off, you can see how much titanium on the abutments is exposed. The doctor had no intention of changing these abutments, which would have allowed the patient to have a better outcome, but many of the doctors who do the All-On-4 procedure simply can't think outside the box. You've heard me complain about this on other videos, and I don't understand it, because problem solving or troubleshooting is half of what we do in implant dentistry. What we like to do first is to see if we can change the abutments. If we can change the angle, that decreases the titanium collar that is visible. If we can go from 17 degrees or 30-degree correction to 0, that really gives us a great chance to lower the prosthesis to the gum line, where we can then make big improvements in the patient's aesthetics and speech, and also prevent a lot of the food packing problem. So the first thing we do in a case like hers is we start with new temporaries. We change the abutments and we make new temporaries to make sure that the patient's pleased with this transition. Once the patient approves the new teeth, which would include the appearance, the speech, and the way the acrylic touches the tissues to prevent food packing, we then move on to what's called the wax try-in, or the wax prototype. We take everything we like about the temporaries and include those in the wax prototype. We also take everything that we don't like in the temporaries and change it in the wax to make sure we're addressing each concern of the patient and the doctor. Here is the wax prototype try-in, and as you can see, it looks very nice in her mouth. We judge this from many different categories: tooth length, tooth width, how much of the pink shows, how it fits on the tissues. We get the patient's input, we get the family's input. We try to combine everybody's opinion about the teeth in this stage so that everybody's happy, because once we go to the next stage, which is the zirconium prosthesis, no changes can be made. So this is a very important try-in appointment. Here is the final zirconium prosthesis. It is customized and beautiful. The metal that's exposed that you can see here is the implant itself, so there's nothing we can do about that. As you may recall from my other videos, the All-On-4 protocol for bone removal is massive bone removal. So when you take away 10 to 12 to 15 millimeters of the patient's bone, you're always going to have some remodeling afterwards, and many times these implants get exposed. But by changing the abutment, we reduced the metal display, or the show of the metal, by about 80 to 90%. Here is the tissue view of that same prosthesis. And again, as you've heard in my other videos, we're always trying to get convex tissue profiles so that the prosthesis can be cleaned by the patient and the prosthesis should never have to come out. I wanted to make sure and show you the abutments that we ended up with versus the abutments that she began with. And as you recall from that first similar slide, we've reduced the metal display by close to 100%. Now we can adapt the prosthesis to the implants much more intimately at the tissue level, and we can also make the area around the implant contact with the zirconium much more intimate so that food doesn't get trapped and that the patient doesn't have a hollow sound when they speak. Here you see the final prostheses. In the upper we have a zirconium implant prosthesis, and in the lower we've got a titanium acrylic implant prosthesis. And you've heard me say in my other videos that for any patient who has any tendency for clenching or grinding, if you do zirconium in both jaws, it's not a good combination. From a biomaterial standpoint, it's too hard. The surfaces are too hard. The patients often make sounds when they speak and when they chew. So we try to be careful by doing biocompatible materials like this. Both arches look beautiful, but one is softer than the other. And I think this is often overlooked by the doctors who do All-On-4. Here's the right side view of the finished product. And here is the left side view, and you'll notice without the implant exposed, the tissue to prosthesis contact is very intimate. This is what we hope for in all patients, and when trying to rescue All-On-4 problems, this is about as good as we can do. And here is the patient's new beautiful smile. She is delighted with this outcome. And here she is afterwards. Of course, makeup and hair have been done compared to the first picture, but to me, she looks like a completely different person in this picture. In 2 slides from now, I'll compare the two for you. And now the supermodel shot. I always marvel at how much different people look with prettier teeth. But this is just an amazing transformation, and we're all delighted over it. Before and after without animation, hard to believe it's even the same patient. Before and after fully animated, and I think you can see why we're so happy with the outcome and the patient is so delighted. And that's it. Thank you for listening. Thank you for watching. And of course, you should visit our YouTube channel. I have about 60 videos there if you'd like further information about what we do here at the Dental Implant Center and why we are not advocates of the All-On-4 procedure.